excuse me. Okay. Because we have the elbow joint here, you know, we can do the flexion and extension. This is very simple, yeah. You can just fold the joint over like a thumb or your hand this way.
Ooh, but is your thumb supposed to be in the way?
Yeah, sometimes I do this just because it is it uncomfortable when I
No,
do
but
that?
it's like a surprise. Like, ooh, maybe you forgot to take it out.
Yeah.
See, if you did that, right, I would know. Oh yeah, you're flexing my arm.
Yeah, yeah.
But when you leave your finger, there, I'm like, excuse me. No, it's not bad. I mean, is that a
Well,
it's okay?
actually, you know, this nutcracker thing, I do this more on the knee
Yeah,
as opposed to the
nutcracker,
elbow.
We use
So,
it for tennis elbow.
yeah.
It's a
Yeah.
good hurt, but it's like, ooh, maybe you forgot, right?
It's like you add an extra little thing
Mhm.
that the joint has to wrap around, so it maybe opens the joint up a little more.
Mhm.
This is another technique, like you can combine it with the pulling. So if you close the joint this way, you know, you close the joint, and then after you open the joint, you can like pull, you know, to open it up more.
See, I know now, and I don't feel so like, oh,
Oh,
maybe
like
you
it's weird,
forgot.
yeah.
Yeah.
I have to treat people for typo injuries all the time that hyperextend their arms.
Uh-huh.
And that's
Oh,
about the only
yeah.
one that really helps it a little bit.
Yeah.
Typo does more damage than
Typo.
Okay. Let me see.
Shaped.
Okay. If we want to do the other thing we can do is rotation. Okay. You don't do it at the elbow joint. Okay, but you can do limited amounts at the wrist. So you know you can start off with a pull at the
I have
wrist.
a question.
Yeah.
Say, if I'm working my daughter's arm, right?
Uh-huh.
So people I know,
Mm-hmm.
should I encourage her grab me so it's not so hard on me?
I don't. No, I
No, don't do it.
I like to have them keep their hand relatively loose because
Okay, don't participate.
yeah, because once they grab your hand, then there's like more tension.
Yeah, because
Yeah.
I thought if I'm thinking about me,
Yeah, yeah.
if she will grab me, it will be easier on me.
Uh-huh.
But you don't do it.
Yeah, I just think
Okay.
you just want them to relax as much as
Mhm.
possible.
Okay,
Yeah.
it's not kung fu fighting.
Okay.
How old is she?
She's 30 something.
Oh, you're not that old. Must be adopted.
Okay, rotation. We can start off with the pull, and then we just take the wrist joint through its range of motion. The
What
wrist
direction?
is not a true like ball. Well, it's not a ball and socket joint definitely, but it's a sliding joint, so it has more range of motion than the elbow, but it's not a true. It doesn't have true like circularity or whatever.
Like the femur head.
Okay. There's also another way you can do rotation. If I turn her arm this way, okay, I'm just gonna go this way, yeah. And my hand is kind of cradling her wrist joint. So when say like the arm goes this way, even though this is also rotating the shoulder, what I'm doing is I'm trying to bend the wrist. Like if her arm is going this way, I'm bending her wrist towards the pinky. If I'm going down, I'm trying to flex the wrist or extend the wrist this way. This, you know.
Is it the same hole as your shaking hole?
Yeah, it is. Okay. If you're gonna do, let's see, the rotation of the shoulder. Okay. Let me just take some of that. Okay, so you can have the patient like sitting in a chair and you don't have to get up on the table this way, you know, you can just stay kind of level with the patient. But, you know, usually I have one hand on the shoulder joint here. This other hand, you want the arm to be pretty loose, so, you know, I talk about like having the hand sit in this tiger's mouth between your thumb and index finger. You can usually feel how relaxed the arm is if you just, instead of grabbing the arm this way, you just hold, let the arm fall into this tiger's mouth area, right? And then you can just kind of take the straight arm through its range of motion this way. And again, if patients do have like limitations in their range of motion, This is a good exercise to try to feel it. You just kind of slowly go through the range of motion, and then if there is a limitation, you'll kind of feel it as you approach it. The other advantage of having this hand here is you can also feel like either tension, or you can usually feel like a binding in the shoulder as you get to that the limit of the range of motion. Okay, good. Okay, there's also another form with the elbow bent. Okay, this one we like to describe as it's like there are two directions. One looks like you're swimming this way. Yeah. And even though we're bending the elbow, this is really like a shoulder thing. All that's happening is that the humerus is kind of rotating in its joint as we take the arms to its range of motion this way. Okay. So this is like swimming, okay? But you want to cross the midline so that it's not just like this.
That's good too.
We're going across the midline this way. Okay, and then the other one is like the opposite, which is like you're slicking back your hair or something like this. But this is like a rotation with the elbow bend.
Well, your index finger is pretty close there.
Okay. So that's like some rotation just on the arm. Okay.